Good morning, everybody. The topic for today is weight management in diabetes. As we all know, diabetes is worldwide prevalent and prevalence is increasing day by day in India. Diabetes is a silent killer. Silent killer means like the diabetes diagnosed patient has already had diabetes but is diagnosed after 4 to 5 years after the onset of diabetes. So what is important is like random blood should be checked for diabetes, screening should be done for fasting blood sugars, or nowadays we can do 3-month sugar test HbA1c. Now coming to the topic, obesity plays an important role in treatment of diabetes. If a person is obese, how the diabetes affects more? In obesity, the main component is insulin. So the insulin, there is resistance of body to insulin for the glucose metabolism in obesity. So like that, if we give any medical treatment to any person, so the dose requirement is high if the person is obese. So and one more thing, there is a strong evidence that type 2 diabetes can be put into remission by weight loss. There are many ways we can lose weight. First of all, first is dietary modification. Dietary modification we can see is like we should avoid junk food, we should cut calories, we should include more fiber in your diet, eat high protein, low carb meals to control hunger and appetite. Second is exercise. Like by exercises we burn more calories. Do 45 minutes of brisk walk every day. By exercising, like we can adjust the output and input of our calories. So if we are negative calories, so we lose weight. So it helps in diabetes.